Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 19. We're going to talk about Francisella and Pasteurella. Welcome to Falcon Physician Review's online review for the USMLE Step 1. This is Microbiology Module 19. We'll talk about Francisella and some of the other zoonoses. Francisella tularensis is a causative agent for tularemia. It also causes rabbit fever, glandular fever, or tick fever. It's a small, non-motile, gram-negative rod that's encapsulated, pleomorphic, and sometimes described as a coccobacillus. It can show bipolar gram staining pattern, and it's an intracellular pathogen. Transmission is usually through an insect bite or a tick bite. You can also get it by handling infected animal tissues, which is why they call it rabbit fever. The primary reservoirs are rabbits and other wild and domestic animals, birds, or pets. Also, you can get it from cats that kill the infected rabbits, and from ticks. Clinical findings include ulceroglandular fever, which is a focal ulcer at the site of entry, as this picture shows on the thumb. Enlargement of the regional lymph nodes is associated, and then you get fevers, chills, malaise, and fatigue. You can also get oculoglandular fever, which is the similar type symptom, except for it's associated around the eye. Most symptoms are due to a cell-mediated type 4 hypersensitivity, so it's our own immune system causing the problem. Lab diagnosis depends highly on your clinical suspicion. This is not something that you're going to see every day, and so you'll only run these tests occasionally, but you'll run serologic assays to look for the bacteria. It's difficult to visualize on direct smears, and it's rarely cultured out of aspirates grown on chocolate agar. Treatment includes streptomycin. Tetracycline, gentamicin, and ciprofloxacin are also acceptable. Prevention is based on a live attenuated organism vaccine for high-risk persons. So this is going to be somebody who's a hunter, who's a meat worker, somebody who's associated with these animals and ticks and is going to be at high risk. Yersinia pestis is responsible for the Black Plague. It's a pleomorphic, gram-negative, bipolar staining, coagulase-positive, non-motile bacillus. It also is facultatively intracellular, and it exhibits a safety pin morphology with staining on one end more than the other. Transmission of plague is through flea bites. The fleas get infected from contact with infected animals such as prairie dogs, squirrels, rats, or voles. When people are infected with respiratory plague, you get respiratory droplet spreads from infected individuals to non-infected people. This figure shows the pathogenesis of bubonic plague. What happens is the flea bites an infected animal, and the organism multiplies in the gut of the flea. The flea then bites the human and regurgitates the organism after biting the human. Few survive neutrophil destruction, but a few of them live, and they drain to the regional lymph nodes. That's where you get the setup of a bubo. It's a hot, tender, swollen, hemorrhagic lymph node. Then it spreads to the spleen, liver, and lungs. You get systemic spread, so you have pneumonia and DIC, intravascular thrombi, and purpuric lesions, often followed by shock and death. Diagnosis of bubonic plague is based on the clinical appearance of buboes. You'll have thick, swollen, tender nodes, and you can aspirate fluid from them and culture it. Pneumonic plague is from a pulmonary disease, and you'll get a chest x-ray finding, and also you can get respiratory isolates. The problem with pneumonic plague is that it's very contagious. Treatment for pneumonic plague is strict isolation. We're going to give them antibiotics such as streptomycin, gentamicin, or tobramycin. Secondarily, you'll give them doxycycline or ciprofloxacin. Yersinia enterocolitica causes ursinosis, which is a gastroenteritis, also a pseudoappendicitis. It's more common in Scandinavia for some reason, or in the colder regions of the United States. Transmission of this Yersinia involves fecal contamination from domestic animals, so you watch your water supplies and your milk supply. You can also get uncooked meat to give you Yersinia. This Yersinia also is an intracellular pathogen. It causes terminal ileitis with diarrhea, fever, abdominal pain, and you want to treat it with antibiotic therapy. You'll occasionally get bacteremia, and that can cause systemic problems. Lab diagnosis is based on cold enrichment. If you remember that Yersinia grows in the colder climates of Scandinavia and the United States, you'll culture it at 4 degrees where most of the gastrointestinal bugs are dead. Treatment, it comes in the form of trimethoprim, sulfamethoxazole, or a fluoroquinolone. Prevention basically involves sanitation, so have clean water and pasteurize your milk. Pasteurella multocida causes wound infections associated with cat and dog bites. Pasteurella is a small, gram-negative rod. They're facultative anaerobes, and they also have bipolar gram standing pattern. Transmission comes from animal bites, frequently in the form of cats. As it's gram-negative, it has endotoxin, but other pathogenic features include its capsule, its ability to rapidly spread through the skin, which causes a cellulitis and a lymphadenitis, and it can become respiratory in immunocompromised or pulmonary dysfunctional people. The clinical findings are wound infections from cat bites. You can get an associated cellulitis or lymphadenitis, and so you think of Pasteurella. Diagnosis depends on culture, but it grows well on blood and chocolate agar, but it's hard to culture, so you need a high clinical suspicion. You think for that history of cat bites. Penicillin is what you use to treat. Penicillin G, you can also use ampicillin or augmentin prophylaxis for cat bites. Other cat-associated diseases include Bartonella hensleyi. That's cat scratch fever, and also you can get bacillary angiomatosis. You'll find that in HIV-positive people, and you'll want to give them erythromycin. One more pearl, if you're thinking of dog bites, you've got capnocytophagia. That's the dog bite organism that you want to worry about. So you've got Bartonella, capnocytophagia, and you've also got Pasteurella. Let's do some questions. All of the following are facultative intracellular pathogens except. So this requires us to think of the zoonoses in general. As we talked about, most of them are facultative intracellular pathogens. The one exception is Pasteurella. It's not facultatively intracellular. In fact, it goes out and spreads through the local tissue to cause cellulitis. But Legionella, Yersinia, Francisella, and Brucella all are facultatively intracellular. Next question. A 32-year-old male returns from a hiking trip through the Grand Canyon. He presents to you complaining of painful, swollen, erythematous bumps on his groin. Additionally, he's got a fever and headache, but no other skin lesions. You aspirate the inguinal lymph node, and that reveals coagulase-positive gram-negative rods with bipolar staining. The causative agent of this young man's illness can be spread in all of the following ways except. So what we have is somebody with painful lymph nodes, and they've got swollen lymph nodes and buboes. So we think of bubonic plague, we think of Yersinia pestis. He's in the Grand Canyon, which is kind of the Four Corners region of the United States where you'll see this. It's endemic. And so how does Yersinia pestis get spread? So you can get it with contact with infected animal tissue. You can get it from an insect bite. Remember, the fleas cause bubonic plague. You don't usually ingest contaminated meat to get this. It's transferred more from animals to fleas to us. Or if you have pneumonic plague, you can get it from inhaling aerosolized respiratory droplets. Next question. A 55-year-old female comes to you with a deep laceration. She states it's from a cat scratch. You irrigate the wound, suture it closed. 2 days later, she returns and the wound is swollen, erythematous, and fluctuant. Culture reveals gram-negative bacteria. What's the most likely etiologic agent? For this, it's kind of just a knee-jerk reaction. You think cat scratch, you got to think Pasteurella. That's the most common thing that you're going to get associated with a cat scratch, so you'll need to remember that. Finally, the health department calls you to evaluate a group of men from a hunting club who have just returned from a 2-week hunting trip in which they were only allowed to eat what they shot. The health department official informs you that the men had eaten deer and rabbit from an area endemic with Francisella tularensis. All of the following findings would be concerning for possible infection except. So we need to remember tularemia and the associated symptoms you have with that. Often you'll get infected wounds, so you will get skin ulceration. You get lymphadenopathy, pneumonia, conjunctivitis, and gastroenteritis. What you're not going to frequently find is arthritis. Let's wrap up Module 19 of microbiology. We talked about Yersinia pestis, the causative agent of plague. We talked about the buboes. We talked about how it spreads through rodents. We also talked about tularemia from Francisella tularensis and exposure to rabbits and other wildlife, and tick and ulcerative fever. These are uncommon agents for causing human disease, but their unique life cycles and the animals and the rodents they live in are good objects for testing in step 1. Be familiar with how you treat them, and be familiar with people with specific risk factors. If you talk about people who are hunting in the woods and eating raw animals, that's a good idea that you have one of these zoonoses. Next up, we're going to go to Module 20, where we'll talk about mycobacteria.